to the Cultivating Calmness podcast. Today, we are excited to have Dr. Suzanne Pikula here. She is a transformative chiropractor and owns several different businesses around transformative healing and healing the mind, body, and spirit. She's the owner of Hope Restored Clinic, Balance Chiropractic, and Renewal Health Center, as well as the Outspoken Healer, which is a nonprofit that focuses on community-based healthcare with the underserved population, as well as healthcare advocacy and so much more. So thank you, Dr. Suzanne, for being here with me and being willing to chat.
Thank you for having me.
I know I don't remember exactly how we met, but somehow I got to know you. You ended up presenting at one of my mental health professionals luncheons, and I know that's a little, a detour for many in the mental health field to see like a chiropractor and think, what does that have to do with mental health? But that's kind of along the path, the lines that I've been on for a while as well. So can you just tell us a little bit about you and how, I guess you decided to get started in chiropractic care and how we ended up here?
So I think that, something you said about how does mental health go along with chiropractic care. And in the West, we tend to think of things in separate and in boxes. But in the holistic realm, everything is interconnected. There is no left without right. There is no chiropractic without mental health. I mean, everything is so entrenched in itself. We have our body-mind connection. So, in terms of chiropractic, I ended up in a chiropractor's when I was 16 and my horse crushed me. And I ended up getting chiropractic care to heal that. And then I went to chiropractic school after leaving more medical-based things because I was pretty burned out with it. And it was interesting. I didn't align with chiropractic care so much in its traditional sense, but and I didn't know, it's funny how we become what we are and who we attract. So I didn't know at that time that I was hypermobile. I just know that I didn't do well with regular adjustments. But I was assigned the one intern in the school who did what I do now, who introduced me to a different way of thinking. And that encompasses that really wide range of neuro, limbic, fascial, emotional, whole body balancing that led me on the path that I'm on now. And, I think I reached out to the mental health folks. I think we met through a meetup or something like that.
Yeah.
And, and I was like, I do a lot. I'm a very trauma-informed practitioner. I worked a lot with regulating the nervous system as well as the limbic system within my everyday work. And I was like, I really need to connect with other mental health professionals because if we're truly going to address the whole person, we should be hitting it from multiple facets of that person rather than going here, 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 because that still gets to the illusion of separation within the patient.
Mm-hmm. Yeah. No, I see that all the time, like with my clients and just the separateness of everything. Actually, I didn't realize in your story that it started with you being crushed by a horse. um, I didn't know that as part of your story. So, and I know just from following on social media and things that you work with horses and you have your own horse. And, so that's, I'm sure provided its own healing for you in many ways. Um,
When I was younger, my sister had an EGALA program, which is equine assisted psychotherapy. And she worked with people, and I volunteered through that. And I did a lot of the classes with horses where you learn where horses mirror humans, their functions and their emotions and things like that. And that was like my true introduction to the nonverbal communication that we all exist in. And I just thought that was a fascinating thing that kind of influenced where I was going as well.
mhm. Awesome. Yeah, so you do a lot of work. So you do a lot of chiropractic care, which, I think many people think you just crack bones and we hear all of that stuff, but you do a lot more than that. Um, and so you don't have to go into all the things that you do, but I know that you do more than um just adjustments with your work. Can you talk a little bit about some of those other things that you do that are maybe less traditional as far as the chiropractic world is concerned?
Sure. In our traditional understanding of chiropractic, and even in chiropractic school, we're taught to find a bone that's stuck and move it and push it back in place. And then hopefully the muscles and ligaments will learn to hold it over repetitive amounts of adjusting. And we learn that in school, just the spine. Now, given my path and the fact that I couldn't tolerate regular chiropractic and was assigned the one intern that could do it, the first time he adjusted my atlas to my foot, I was hooked because that's a system-based approach. That's not a do this, work on this. It's okay, this hurts. Let's go 6 steps back and figure out what's causing it in the first place.
Uh-huh.
And it's kind of like the inventor of the technique one of the techniques I do, about 10, was an engineer. So it's like a systems-based approach rather than focusing on local pain, local discomfort, because the body exists in a 3D dimensional space. I mean, you have your fascia, muscle, bone, cranium, lymphatic, everything's moving together. So if you have one lymph node that isn't moving well, you will subluxate in the low back every time. If you have emotions stored in your liver that you're not processing and that's not moving very well, you'll have chronic low back pain. If I tell people to think about the fascial system, which overlays the muscles, overlays the bones in which your organs sit. And a lot of people who have had C-sections end up having chronic neck pain later because you're cutting through 7 layers of fascia or 7 layers of the body. And then they just sew it back up and then it pulls you through. So eventually that person will develop neck pain because the scar was never addressed. And so you just work on a local area, you'll be working on that local area forever until it masks again and then it shows up again 6 months later.
Right. No, I love that. Because you're right, like that's not something people think about. And I think I learned the C-section thing from you.
Yeah.
I didn't realize it would actually affect the neck. I thought it was there were other areas maybe that had come up, like just like your lower back, but on the other side, which I think is also true. But that neck thing makes a lot of sense as well. Interesting. Okay.
Yeah, very down the rabbit hole, but again, it's more Eastern of everything goes together rather than our Western of like chopping things up in pieces and parts.
Right, right. And that's very, yeah, like very Western, very traditional allopathic medicine and very separate. You know, you go to the heart doctor for your heart issues and the neuro doctor for your brain concerns, but we don't see why the two are linked together. Um, so I love that, like, that's how you do things. So, like, when it comes to, our mental health, how does some of the work that you do help with things like anxiety, depression, ADHD, etc.? I mean, there's obviously tons of ways it can help, but I'm sure you see a lot of that in your clinic. And like, can you tell us a little bit about how that's helpful?
Well, a couple of things. So different concepts here. So we have this thing called the cranial-sacral pump, which you've probably heard of. It's the fluid that flows around your brain and spinal cord, surrounded by 3 layers of tissue, the dura mater. Your brain, you have a cranial-sacral pump that's pumping fluid 8 to 12 times a minute. It is separate from your heart. It is separate from your lungs. It is separate from everything. That fluid acts as the lymphatic system. So pumps, you have all these bones in your head that pump it down to the sacrum and they pump it back and forth. They all move in 6 different directions. So one of those bones is out, everything flows out or everything struggles. So, that fluid is actually nurturing and filling your brain and spinal cord, but it's also dumping and clearing it out. It's kind of a self-clearing system. So often we'll see like somebody who's coming in who's highly anxious, or maybe they're neurodivergent, or they're on the spectrum somewhere. Those folks tend to have a higher amount of CSF fluid in their head and not moving through their bodies as well. So that's where craniopathy, actually moving the cranial bones and then resetting the sacrum, will actually help calm down the extrasensory stuff that's going on in the brain. But the second part of that is also the body doesn't heal if it doesn't feel safe. We've lost a lot of safety within our body work. We have this intention that we go to the doctor to be fixed. We go to the chiropractor to be fixed. But most people have heavy amounts of trauma that they're, one, not aware of, or two, they've just suppressed. And I think, his job as practitioners to kind of recognize what they're doing, because I can adjust you as much as I want, but you won't heal if you don't feel safe. If the body doesn't feel safe, it will receive the work and it'll kick it back out. So the second part of what I do is I do somatic and trauma-based work to actually reset the body's limbic system before I do an adjustment so the body can actually accept and integrate the work.
Oh, okay. What does that look like? How does that like what is that kind of
So it can depend on the person. So maybe sometimes it's more of an associative reflexive technique. So we're actually engaging the body's deep tendon reflexes because those will tend to hold trauma. Sometimes we're doing longer holds around the cranium, especially around the vagal nerve or around the trigeminal nerve. Sometimes that involves doing deeper holds where we're doing guided visualization into the body part because we tend to run away from pain. We don't run towards pain. Sometimes that can look into a guided visualization, or often they'll do fascial holds where people are like working one part of their fascia while I'm releasing the other because the brain can only think about one thing at once. It cannot think about two. So you have to allow the body work to come in a way that the body can receive it. And that's part of that kind of what I'm doing is seeing where people are able to receive the work versus what I'm going to do with them. And, that may change how their nervous system is performing one day versus another.
Okay. No, I like that. I see I see a lot of that in like the therapy office too. Which I say similar things to you as far as like adjusting. Like we can do all the therapy in the world and we can talk through all this stuff, but you know, I can't heal like your gut health. I can't adjust like your body if it's out of sync. Like you need other resources, you need other people to help you do that. And I often see, because I do a lot of like EMDR work and I specifically work with trauma as well. And so seeing like I see those body movements in people and like to me I can see it. I'm like, I see there's something stuck here. I can't physically help you get that out. So like going to see someone like you who can help with that and assist, right? That's where we can have like that type of collaboration or other clinicians can have collaboration with other people like you who can facilitate some of that movement and that healing because those traumas and things do get stuck in the body. So you've talked
But I
about,
love
yeah, go ahead.
Oh, I was gonna say what I love about like EMDR is the eye movements. There's a technique that I'll use called eye conjugate reflexive technique, which will use the eyes to adjust the body
Okay.
because the eye muscles are integrating with different parts of the brain, as you know, with EMDR, but it also affects the rest of the body too. So you can use the eyes to actually counteract chronic muscle holds that you're having in the body.
Have you heard of brain spotting?
Hmm.
Yeah. So, I mean, it sounds like that as well, because they use where your eye placement basically is and where it's focusing and use that to determine where like healing needs to be. Is it similar to that as well?
So we're using more the muscular system. So like you can if you counterbalance it on the other side, you can use the eyes and some facial movement to actually move a bone and then release it on the other side. So it releases the whole fascial system.
Wow. Okay. That's amazing, and I don't think that many people are aware of that. In chiropractic world, how many, how, how many, how, how do I say this? How common is it for people to understand what you're saying?
Not many.
Okay. How many of you are there out there?
I would say there are people who do pieces, but I have not met anybody who does all of it.
Okay. So very unique. And I'm glad that you're here in Central Ohio
Yeah.
uh, for people who need your services. So can you talk about the fascia and the way the fascia holds trauma?
So the fascia, we have many different layers of fascia. Your frontal lines, side lines, oblique lines, things like that. And the fascia actually has its own kind of nervous system. They're really diving into this now. The fascia holds the memories. When we have trauma, our bodies are so smart. Like we'll lock down the jaw, we'll start to breathe shallowly, our gut will clench, we'll start to disassociate or kind of leave the body. We'll start getting chronic pain because the body will start to like go into more of a fetal position. So that fascia is that memory there. So it's going to hold that memory of that muscle tension of how your body is basically held in space. If we think of fascia like a puppet system, right? It's going to hold those chronic positions. So when your brain has pushed, the trauma in the box or put it in a way that, the body can accept it, your the fascial memory is still there. So even though you're working out, doing things, all the things, and you put that to the side, your body hasn't forgotten it. The emotional limbic system connection of that fight or flight, that's not forgotten. So your body will keep trying to go towards it because that's what it knows. Because that's in its mind, it's keeping you safe.
Okay. Um, so we basically, like our bodies, like that book, The Body Keeps the Score. I'm
Yeah.
sure you read that or know of it, right? And so, um, when it comes to like working with people, who have these traumas and have these things going on, um, how do you start to like address those things, with what you do? And then a follow up to that, and I can ask it again, but how do we see that benefit them with their like anxiety and the way that's presenting for them?
So usually the way I do it is through my intake, but we sit and have a conversation before I ever do anything, before I do an exam, before I do anything, because that gives me a chance to read their energy and seeing what's going on and what their body's telling me versus what they are telling me, because often what they tell me is a very different story than what their body tells me. And it's for me to ferret it out. And then, I always ask people, I'll be point blank about it. Because I do so much work on the front of the body and most chiropractors do not. We have a conversation about like, is there anything I need to know? This is your session. If anything makes you uncomfortable, you need to let me know. So, or we need to create a hand signal or something like that. I've had to do it with some folks where this is their session. It's not my session. It's theirs.
Mhm.
And to make that very apparent, because I think, again, we give our power to healthcare providers. That is what we have been taught to do. Even going to holistic healthcare providers. If you're not careful, sometimes you can re-traumatize the system if you are not having an open communicative relationship with it.
Mhm.
And so, having that conversation where they're in control of the session, and then some people respond very well to deep pressure. Some people I have to barely touch because that's where their nervous system is.
Mhm.
So it's again talking to the system and feeling it and seeing how it's responding. It's a bit of a feeling in the body and kind of deciding, okay, we're good for this work for now, or okay, yes, we can go deeper. And it tends to have a layered effect. But what I hear from folks is, hey, I'm not going from 0 to 20 in 5 seconds anymore. Hey, I can get through my day. I'm having better concentration. My anxiety is not so high. Or wow, I didn't realize the connection between the jaw and the pelvis. Like I'm actually able to relax my jaw and I don't go to the dentist as much. I'm able to go to the bathroom easier. My gut's working better. I can digest. I can eat better. So things like that are common things. My biggest goal for people is to become aware of their bodies because most of us are very out of our bodies. So I hear a lot of, hey, I notice this. And, I caution people like sometimes what will happen during this type of work is if the body's not ready to let it go, they'll have a reaction because that's the body's keeping itself safe again.
Yeah.
So I have people check in with their bodies to, if something happens like that, to go into it and hold space for it and maybe put some light towards it and sit with it and see why it's there rather than immediately shoving it away. And I find that through this work, people are able to do that. They're able to drop in more and more and more into that space.
Mhm. Yeah, so it's obviously it's not as you kind of said this before, right? It's not a one time fix either. Like when you work with people, you're seeing them regularly. And I'm guessing it depends on them, right? You see them as individuals, not as like right. They have to come in once a week or this many times.
I would actually say I've had a few. If they're actually ready, I have seen people where I've seen them once and they've never needed treatment again. That does not happen very often. The person has to be ready for it, but it does happen.
Yeah.
But yeah, I don't see people 3 times a week, 2 times a week, whatever like that. And I always tell people that you'll actually be able to tell, as your body starts to hold what, their body always sets the frequency,
Hmm. Um,
but not in the beginning because they can't tell.
yeah, so like obviously there's a spectrum in how like people can be helped by this. One is like getting them to a place where they can be ready to receive that help and are open to like hearing about it, knowing about it and going there. But I'm guessing maybe the many of the people that come to see you are at least partially there. Like they kind of know what you can do. They want to be there, but their body may or may not let them do that. And that's where some of that additional work comes in.
Mhm.
Um, so when it comes to like these adjustments that you do, or even just in general, like chiropractic world, you kind of talked about it, right? Like adjusting helps that like the fluid around our brain and helps like to regulate things. But how else do you see um chiropractic care assisting in that healing and regulation of like our nervous system when it comes to like any of the mental health specific related things we're talking about, that anxiety, depression, high stress, ADHD, like fill in the blank.
So in straight chiropractic, I would say the explanation would be is if you're taking pressure off the nerves, then the brain and spinal cord can function better so they can send better signals to the rest of the body and to calm the body down.
Mhm.
In my world, your cranium and your sacrum are your parasympathetic nervous system, so that calms you down. Your sympathetics are in your thoracics. And so if you're upregulated in that sympathetic system all the time, you're not going to be able to regulate your body. If your vagus nerve is overstimulated because you have compression through the cranial bones or through the diaphragm or anything, your body can't calm down because the vagus nerve is actually what calms down a lot of the body. It upregulates it and calms it back down. If the cranial fluid, a lot of things, there's some thought around anxiety and depression that it's even an inflamed brain that's causing some of it. Trauma with that aside, that like you start getting, environmental toxicants, you start getting anything that's an intoxicant to the brain, you start getting inflammation, you start getting massive reactions. The body's actually telling you, hey, something's going on.
Mhm.
So, it's interesting seeing like the studies for like Parkinson's people and like people with neurodivergence that they have a high amount of cranial fluid. And once you get that back down, the symptoms actually start to release and go down. So, cranial therapy is actually very effective for anxiety just because it lowers the load that's on the brain. You
Mhm.
start adjusting the diaphragm and things like that. And in the body, um, a lot of anxiety will calm down. And then again, depression, it's kind of like, I generally think of depression as like, you have trauma side and things like that, but what are in your life are you not in alignment with? Our bodies are and brains are very good at telling us that.
Mhm.
And so in terms of chiropractic, again, it's regulating the nervous system, but increasing neurotransmitter production. It's sometimes we work on the gut because people eat bad things. You eat bad things, you're going to have a bad mood. You are what you eat. And if your gut isn't functioning well, if you're eating highly inflammatory foods, you're going to have highly inflammatory brain reactions. So if you actually work on the gut, you work on the diet, you work on the organs, getting the liver to move, getting the liver to detox, there's a big link between liver being too full and depression. So if you start adjusting the liver and getting things to move again, you take the chemical load off the brain and sometimes depression symptoms will get a lot better.
Yeah, I mean you're hitting on all those like other body systems as well, and we can totally like go there. And I know when you came and talked to the like a lot of the clinicians, the luncheon that we had, you referenced all of those things as well, right? It's like the environmental toxins and the food toxins, right? It's it's not just food. We think of our brain. Sometimes people call your gut your second brain, right? But I almost say like it you know could be considered your primary brain because you have to feed yourself in order to like live and survive, and your brain isn't going to function if you're not getting nutrients. So like you said, like if we're not feeding.
Well, 80% of your serotonin,
Yeah.
80% of your serotonin is made in your gut. So it's very hard for me. I understand why we go after the brain, but the gut is such a huge thing. And, you know, in studies for kids with neurodivergence and autism, they know that red dye inflames the brain and puts it on fire. We know that. Yet we still give kids, things that they can't digest. High fructose corn syrup is more addictive than cocaine for rats. Yet that's in most of our foods. So it's kind of like going back and forth. Why aren't we looking into this?
Mhm. Lots of reasons.
Oh, I know. I know why we don't, but I think it's just insane.
Yeah. Um, and I'm just thinking like when you say that, I know we're working on that like in our house with our kids. And, I don't know about you growing up, but me, we ate all the things, all the, food dyes and all the stuff, and we were fine. And so now we don't like let our kids have that, but when they do have it, I see it immediately. Within 20 minutes I can see that my my oldest is like off the wall, like can't tolerate food dyes specifically. And I'm sure there's other things he can't tolerate too. So like I think that just is a visual for me representation of like what you're feeding yourself like can affect your mood. And trying to get that across to people that there's other things that can affect the way you're feeling, and it's not just life. Like I wasn't just handed this, I'm what did they used to call it? The chemical imbalance. Like you just have a chemical imbalance and we have to rebalance those chemicals, but like we don't have any control over that.
That was a theory that was disproven because that was actually promoted by like pharmaceutical companies in the 90s, which is just asinine.
Yeah. Yeah, I know it was like several years ago where they like came out as like this is not true, but I think people like you and me already knew that. um
I wish, like, I was diagnosed with severe migraine and OCD at age 8, and I was put on Luvox. No, I was put on an SSRI. Zoloft. I was put on Zoloft. And I was put on Midrin for the migraines. And at that time, I'd already had asthma and I had like some other things. And I went through my teenage years, taking SSRIs, going to counseling, doing all the things, only to figure out like the mold connection, like in my 30s, that it was actually a mycotoxin mold issue that I'd grown up with that would cause the severe OCD. And then it was an undiagnosed chemical sensitivity that caused the migraines. And had that been addressed, I wouldn't have wasted time taking SSRIs or things like that, because now once those two things are addressed, I don't have symptoms of either one. But again, it has that link to chiropractic too. I tend to see people, I'm not the first chiropractor people see. I'm usually the last chiropractor see because they've seen everybody else. They've seen all the doctors. They've seen everything. They're like, okay, I know you're going to look deeper. And I get frustrated because we have such a linear mindset about thinking about things rather than an expansive mindset. And, with the chiropractic that I'm doing, often I'll do it with people, but I'll say, hey, you need to start looking into this, look into this, look into this, look into this. This will help you.
Mm-hmm.
And we see improvements that way. I mean, I had a patient with autoimmune symptoms and she was eating cold foods all the time. And I said, you are trashing your gut. How are you supposed to heal if you are trashing your gut? Mm-hmm. So we started adding some things in, and a lot of those, it was interesting. A lot of those symptoms actually started to go away. So again, it's the body's way of expressing things. Are we treating it? No. But are we supporting the body in a way that it can accept? Yes. Mm-hmm. So it's kind of, again, looking outside that box.
Yeah. I think that's a hard place to be for many people, is to like look at things differently than they've been raised to look at them, when you come from that medical system that looks at things in boxes. Even myself, I find myself like, falling into that as well. And I think you mentioned it earlier, just even holistic providers can still be, driven in like certain directions and still don't look at things from that like whole person perspective, because we can still like become more narrow focused. And I know I can do that at times too. So it's, catching myself and being able to explore like those other things that may be going on. But it's hard to get and maybe you don't see this as much like in your practice, but I know I do. Like even just mentioning chiropractic care to people, like they've had a bad adjustment, or like somebody has, somebody they know, or they just hear the bad stories and they're like, oh no, like never gonna do that. That's bad. They're gonna break my back, or I'm gonna be paralyzed. And I'm like, I'm sure that has happened. But that doesn't mean that that's everybody.
Yeah. Actually, I do have those conversations, but I'm a very direct person too. So if somebody comes in and said, "Hey, I've had people say I'm only here because my wife made me, and I believe in chiropractors," and I'm like, "Then why are you wasting your time? Why are you here?" I mean, I'm out front with it, but also people will come in. Now, I don't do HVLA so much. I have a different way to adjust the neck. Um, because I like, again, we are what we attract, right? So I can't have my neck adjusted that way. So I learned a different way. It's not activator, it's just soft tissue. But I get a lot of people in because they have not done well with regular chiropractors because they have had bad experiences. Now, I don't think it's that the chiropractor's doing anything wrong. I don't think it's a good fit. So like somebody who's extremely hypermobile doesn't generally do well with HVLA. They don't do regular chiropractic very well because they're already extra mobile. They don't need more mobility. So that's why they tend to have a bad response to it.
Okay.
Or I've had patients who've had scary times and they only come in because they're highly referred. And so we have to build a whole lot more trust around it. Now, I mean, that being said, I've been hurt by chiropractors as a hypermobile person. I've been hurt very badly. And that's where I've learned that. So again, discernment is key with the provider that you work with. But I mean, every profession has its good and bad or has its learning lessons. I mean, I had a patient come in and tell me all about turmeric and how it causes kidney failure and the study that she looked at. And I said, okay, 10 people died over 11 years. Do you know people die from Tylenol each year? So again, I think we need to be careful about reading our things like that and really keeping a discerning eye and keeping that expansive mindset rather than this mindset. But as well as I do, there's a really good shall we say,
Mm.
pushback against holistic medicine.
Oh yeah.
I mean, Rockefeller Medicine was an amazing book. That was a really good medicine man. It was a really, really good book. And there's a lot of things, again, I encourage people to go deeper. We have to research so that we get our true answers rather than what collective thought.
Hmm. Yeah, I know the pushback on the holistic. Um, I see that just in my business. And I changed my business name, was it a little over like a year and a half ago now? And from the moment we changed over to what it currently is, like everything dropped and like nobody sees my stuff anymore. And it's been a year and a half and we're still fighting um shadow banning and like things like that. And people outside of this realm don't understand what that is and trying to explain, like, I talk about these things, like I'm talking with you, like might not get much traction because it's not mainstream and it's a little different and we're looking at things from a different perspective. And that's not really wanted all the time.
No, I think it goes against the accepted paradigm of care.
Mhm.
And if you go against the paradigm, there's a lot of pushback. But you affect one person at a time, and that person makes big changes. And that's, I think, how it's built. You'll find it's more by resonance rather than outward expansion of these massive movements. Because we're in Ohio, we're not in California, we're not on the East Coast.
Mhm.
Or even the West Coast. Sorry, California's West Coast, but like East Coast. But we're in the middle of the Midwest, and that's a harder space I think to be in because people are very much raised on the conventional thought here, and to go out expand, they have to be pretty desperate to step in the outside of the box.
Mhm. Yeah, no, I agree with that. Um, Now, like, I don't know, we've touched on a bunch of different things. I'm sure we could go down many rabbit holes here, but try to stay on topic. It can getting coming to see someone like you, or even just getting some traditional chiropractic care and adjustments can help with many things and can help regulate the body in many ways. Like we see that with um, like sleep and um, just like mood regulation. They kind of you hit on that. Even like you see in babies, like being able to poop, because things are not aligned correctly. So when it comes to like the different systems in our body, you've hit on the parasympathetic and the sympathetic nervous system. Um, what about like our brain and the different kind of like um functions of our brain? How like the limbic brain, how does that affected by what you do?
Well, the parasympathetic and sympathetic do regulate the limbic brain as well. So limbic is your emotions. You're hitting the brain, and your brain is talking to your spinal cord to go ahead and do things. And that's kind of interesting where the trauma techniques come in, is a lot of the trauma techniques are to put the body back more into parasympathetic. So like, again, a lot of people do this when they're in sympathetic. They'll tend to have like jaw tightness. They'll tend to grind their teeth at night. They'll tend to have gastrointestinal issues. They'll tend to be hyper irritable or anxious or jumpy. That's a sign of an unregulated sympathetic system. So in terms of, your brain communication, that's again, your cerebrospinal fluid that's actually nourishing the brain and spinal cord and actually allowing it to move. But when you're adjusting the cranial bones, again, you're affecting the different parts of the brain that are talking and receiving and things like that. We'll often see that with like, one, you see it with babies, but two, you see people with traumatic brain injury when they're having massive deficits. So maybe they're having deficit with light sensitivity. They're having deficit with sound, things like that. You can do cranial work, and actually a lot of that will resolve because you're taking pressure off the brain and spinal cord and allowing the brain to move as it should. But you'll also see this in babies, which is like fascinating because, a baby often takes on its mother's nervous system. So if the mother is anxious, the baby will be anxious. If the mother had a traumatic birth, the baby usually comes out highly anxious. We pass down toxins, we pass down trauma, we pass down everything to babies. And I'll watch babies actually, they'll sit and regulate their mom's nervous system. And it's just kind of cool to watch the interplay between the body language. But like you'll have babies that like will come in that'll be highly anxious and they'll actually even start to show sensory issues. And if you do the cranial work and you do 90% of the nervous system is built by age 2. So if you do the work while the roads are being laid and the traffic lights are being put up, you can circumvent a lot of the aberrant brain signals that are starting to develop in an environment that is not ideal for that baby's brain to develop.
Okay.
Does that make sense?
Yeah. So when people are getting their kids to you after, right, when they've surpassed all that and the roads have been laid and paved and built and, except they're wrong, right? They've like gone off the path and they're not kind of aligned correctly. What do you do?
I wouldn't say they're wrong. I would just say the body created a different route. So it's kind of going back and figuring out, okay, what can we do to help regulate the system? It's harder after 2. I'm not going to lie to you, but it's doable. But it's unwinding a lot of things and figuring out where the chronic postures are, where their nervous system's sitting. Again, we'll see more sensory regulation things. So I'll be like, okay, is kiddo more comfortable being hugged or are they more comfortable not being hugged? Do they like lights? Do the lights bother them? Where are their food sensitivities? Are they bothered by tags? Are they having, does it feel like things are crawling on them sometimes? Do they tend to go from 0 to 10 if you correct them too harshly? So it's kind of figuring out where their nervous system is firing and then directing the treatment towards that.
It's really about opening up the body and being able to kind of clear those pathways and to be ready to kind of accept that change. And once you are, like a lot of things can start to happen, whether it's in one adjustment or session with someone like you or multiple. Like those things can affect the way your body is able to hold and release traumas and anxieties, etc., making you more than able, yeah, resilient and also able to accept other treatments as well. Would you say? So like coming to therapy or gut healing or other things, like you're more able to see those things potentially?
I think, I've noticed like a difference between I grew up and for kids versus now. I mean, we always do, right? But me growing up, my parents never got body work. They didn't go to counseling. They didn't eat healthy. They're the boomer generation. They just toughed it out. And that's the way I was raised. And, it wasn't until grad school that I started going, oh, I need a massage. I mean, I got chiropractic at 16, but I wasn't getting regular chiropractic. I wasn't. And I think about, I'm 6'3" and at 40 and my knees are starting to hurt a little bit. And I think, when I went to chiropractic school, all these kids have been adjusted since birth. It was amazing. Like nobody really had chronic health issues, nobody got really dealing with disabilities. Like they were so healthy. And the kids that come see me, like they're so healthy. And the parents talk about that. And it makes their system so much more resilient and able to take on the stresses of the world. I mean, if you think if you meditate 5 minutes a day,
Mhm.
like your whole output changes because your parasympathetics are engaged. Like
Mhm.
you'll notice that you don't react as fast or you're able to be more calm. And I think that, we are now being taught to become stewards of our bodies where we're, going to mental health, we're going to therapy, we're going to work out, we're eating healthy. Whereas in my generation, probably your generation, that was really not that expressed. It was you just push through and just do it because you have to.
Mhm.
And
Yeah.
so, yeah, I mean, it's pretty harmful, I think, to have that mindset because then we have these folks who have never done this and our elder care is atrocious. I mean, Americans don't live that long, and my generation, I think, is not really supposed to outlive their parents.
Yeah.
So, I mean, the numbers are talking. So, I mean, any type of therapy, whether it's chiropractic, massage, things like that, it will help the body regulate the way that it needs to. And I think about like my kids that work out in high school and they become runners, they get arthritis by the time they're 30. If they're not working out, if they're not getting body work, or the kids, if they fall on their head a lot too, they will have issues later. But we just call that bumps, right? So some of that thinking's still there. So yes, I agree. It does make us much more resilient when we are able to go into these therapies and do things for ourselves, and it's not selfish.
Mhm. Yeah, I think that you hit a good point there. It's can be viewed as like selfish and um you know, even like being too much, I need too much, and what I say to people is that like, like you and me, if we were starting today, you know, we have 30 plus years of trauma and stuff that we've done to our bodies and our brains and trying to release that and trying to heal that is going to take time. It's not going to be a pill, it's not going to be a one thing or a supplement, that's going to solve like all the problems for us. It's going to take a combination of like services and like healing to get us there.
And I would caution you, I tell people, I'm like, pills are not silver bullets. Pills suppress things. And they often take minerals out and create other depletions in the body, even supplements. So what we have been illusioned or, to think that it's a fix is literally a suppression. And it kicks the can down the road to create problems later.
Yeah. Yeah. I don't think the um thing that I've been learning recently, and you kind of hit on that, was just that mineral depletion from like what our medications can not allow our body to absorb. And, like you said, even supplements can do that if you're taking the wrong thing or too much of the wrong thing. I think easy ones that I talk to people about, is like vitamin D today. It's like, you know, overcast, you're still getting vitamin D, but we're in Ohio. So like winter, we're not getting much of that. And so we're told to take, vitamin D. Well, I've learned, and you could probably tell me more, but you need vitamin K to go along with vitamin D, and there's other things you need as well. And if you don't, then you could be offsetting that balance, and you're not really getting what you need from those vitamins if you're not also kind of counterbalancing them with something else.
It's always a counterbalance in the body. It's never a one thing fix.
Hmm. Okay. Are there um are there any other things that like we haven't touched on like today related to some of these um mental health related symptoms and things that you see that you think would be important for people to know?
Going back to C-sections, right? So women get C-sections, and they're up in 24 hours and they're booted out, right? So not quite so, but kind of. And then they're expected to be a mom, be a wife, be, things like that. Or when we get hurt, we're expected, think about your period, right? I mean, when I grew up, it was like, you take ibuprofen, maybe a little heating pad, you use a female product, and then boom, you're done, right? The way that people are treated in the society, but particularly women, is very much like, don't take time to heal, go and do what you have to. And that bypasses the emotional space. That bypasses the physical space. That bypasses your needs. And I would say that men probably have this too, but men don't have periods. Women do. Men don't give birth. Women do. And, women are really, I work with mainly women. I work with some men, but mainly women. And it's a lot of, I also work with high achievers and, type A's. And it's a lot of unlearning to learn to stop and rest and give your body time to rest, because we can suppress all damn day, but it will catch up to you later. Especially in your body, in your mind, in your soul, because women, I don't think we're meant to like do that. I mean, I understand that it functions in our society, but I don't think it's healthy for us. I don't think it's healthy for men to bypass their emotions. And I talk to men about that too, and about how they keep it in their backs and they blow their back out. There's a big connection, men and women, about like being the financial provider for the family, and they have low back pain all the time. Your body will always tell you what your mind cannot. And I think that's the big important thing here, is that when somebody's having pain all the time, they're getting all this work done, but it's not resolving, that maybe sometimes they need to go a bit deeper, because it's often not just at that surface level. Often it's like 6 levels below that they're not addressing. Mm-hmm. And taking the time and the rest, and yes, the money to do so. Because healing yourself is not selfish. Spending money on yourself is not selfish. We want care in a system that is not built for individualized care. We want to pay our insurance companies to pay for care for these doctors who have to see us in high numbers so that they can make enough money to keep their doors open. At the same time, we are wanting this individualized care, but that system can't provide it. So I think at the end of the day, I encourage people to take governance of their own health and their own care and work with providers that can actually provide what they need, rather than shoving themselves in a box and expecting miracles.
Mm-hmm. Yeah, no, I hear that, and I hear, I experience that, and it's feeling trapped in that system, right? Like, I can't afford to go, see a specialized care because my insurance won't cover it. But then when I go use my insurance, they don't get me the help I need, and so then I'm here in this middle space, which is why like you're not the first chiropractor they see, because they've been to everything else and they're not getting the answers. And I think, we are part of that system that's trying to even just float ideas. So I do that too. Like, well, have you considered that this is what's going on? Have you looked into, right? I don't know that a lot of people are ready to hear those things, at least, who come to see me. Some who come to see me are there and they're ready to hear it and they know what I do. And some are, not there. And so just trying to gently, float that idea that there may be other things at play here. And you may consider, getting something tested, going to a chiropractor, going to other providers that can, help you. And yeah, you may have to save up. You may have to, do things a little differently in order to make that happen. It just sucks that that's the world we kind of live in. Where that's
I actually tell people it's cheaper. It's interesting. When you pay out of pocket, it's often cheaper because you actually need less treatments because you're not sitting in a box versus like going ahead and investing. But a lot of folks struggle with that because they struggle with paying for things, or they may not have the circumstances to do so. But it is interesting once you shift out of that mindset, that it's interesting that it is cheaper, and that then I have people who are like, well, I'm going to grow my own food. I'm going to put a hydroponics plant in my house. I have power. I can change this. I think it's empowering yourself, knowing that we can shift things so that we feel like we have more empowerment in our lives and we're not stuck in that system that tells us what to do.
Mm-hmm. No, I like the way you put that. Yeah. Because I don't think people feel very empowered. It's great to see, and I'm sure you've probably seen this, but I know when I see it in my clients where they'll come in and they'll tell me, "You won't believe what my OB just told me," and I'm like, "Oh, do tell, do tell," And then my jaw like hits the floor, and I'm like, I mean, I expected that, but okay. But that they, felt empowered enough and that they had that knowledge and they had that ability to know, even going in themselves, like, they're probably going to tell me this. So I need to have, information. I need to, feel confident in what I know and what I can say to them. And I think that's great that, I have clients that are doing that now. And it sucks that they're in that system and they feel like that they have to do that, but we can empower them in ways to hopefully get what they need through the system that they're in.
You have to become your own advocate for your healthcare. You will never survive the system otherwise.
No, I
But
agree.
teaching people that they have more power than they think they do, I think, is the key. Because we've been conditioned to believe we have no power.
Mhm. Yeah, you're right. Yeah. Um, well, I think I've asked a lot. I'm sure we could, go off on some tangents, but I'll probably leave it at that. But I really appreciate what you bring to the world and what you like bring to our area and your clients. I know that you are helping people in ways that most of society is unaware of, and I'm hoping that more people become aware of like what you do and other doctors maybe start to do what you do because I think it's very needed and lacking in society today. So thank you so much.
Thanks for having me.